Good morning, students. Today I will be discussing about the Good morning, students. Today I will be discussing about the Nsaids, that is for medicinal chemistry, fourth semester, PP 402T. First of all, we should know what is Nsaids. Nsaids are means non-steroidal anti-inflammatory drugs are used primarily to treat inflammation, mild to moderate pain, and fever. That means inflammation or pain will be reduced by these drugs, and in case of fever we can use these drugs. So specific use include the treatment of headache, arthritis, sports injuries, and menstruation cramps also decreased. Aspirin is used to inhibit the clotting of blood and strokes and heart attacks and individuals at high risk. NSAID is also included in many cold and allergic preparation also. So why it is called non-steroidal? In the previous time, steroidal drugs were used for the prevention of the inflammation or pain. So that steroidal drug causes different side effects like the hormonal increase, atherosclerosis, like different problems. So that's why to preventing this problem of the steroidal drug, newer drug molecule has been introduced that is known as the non-steroidal drugs. So how the non-steroidal drugs work? This is a mechanism of action. If there is any cell injury or any inflammation, the cell wall phospholipid is converted into arachidonic acid. The cell wall phospholipid is broken down by the phospholipase A2 enzyme and they are converted into cycloendoperoxidase or hydroxy acid of arachidonic acid. Here, two most important enzymes are working, that is the cyclooxygenase 1 and 2 and lipoxygenase. So NSAIDs drugs inhibit this action of this enzyme. As a result, arachidonic acid cannot be converted to cycloendoperoxidase. So whenever cycloendoperoxidase is converted into prostaglandin, they secrete the prostaglandin different type like PGE2, PGF2, PGT2, which causes inflammation and pain. So that type of pain and inflammation will be reduced by this drug because they will be preventing or inhibiting this enzyme. And some nucleotide also there, which will also make some release of some inflammatory agents as well as decreasing the platelets. Okay, so there are two type of drug which inhibit the cyclooxygenase and lipoxygenase. Cyclocox inhibitor, that is locally known as the COX inhibitor, and this is known as a LOX inhibitor. So these are the general drugs, and some of the newer inventions are one for the LOX drugs also. So the most important problem of the side effects of this drug. If the NSAIDs drugs are taken for a longer time, there are a number of side effects. So the frequency of side effects varies according to the drugs. Different drugs and different timing may cause a different type of problem. The most common side effects are gastrointestinal tract disturbance such as nausea, diarrhea, constipation, vomiting, decreased appetite, and peptic ulcer, which is the most common. And hepatotoxicity, liver problem is also there, and food problem is also there. So whatever the problem, we have to study the drug. Now coming to the classification, that is very, very important for you study. Salicylic acid derivative. So whereas it is aspirin, diphenyluracil, salsalate, sulfasalazine. Whereas aspirin, sulfasalazine and salsalate is important. Para-aminophenol derivative, paracetamol, phenacetin, very good drug that is used for a longer time. Next, pyrazolidine derivatives, phenylbutazone, oxyphenbutazone and sulfenpyrazole. Now coming to the anthracnonic acid derivative, that is mefenamic acid, very important drug. Flufenamic acid and meclofenamate is not so important, but mefenamic acid is very important. Classification continued. Aryl alkanoic acid derivative. So that is indole acetic acid derivative, indomethacin, indane acetic acid derivative, sulindac, pyrrole acetic, tolmetin, zompirac, phenyl acetic acid, the propionic acid derivative, very, very important drug. Ibuprofen, diclofenac, naproxen, caprofen, phenoprofen, ketoprofen. These are ketorolac and etodolac. These are the very important drug for the pain reduction and inflammation. Another category drug, oxycam, pyroxycam, newer category, that is the injectable meloxicam, tenoxicam. And selective COX-2 inhibitor that will particularly inhibit the COX-2, celecoxib, rofecoxib, and valdecoxib. They are the newer drugs. Now, there are a number of gold compound which is very important and very important in case of specific type of problem, and they are costly also. Auranofin, oro, because aurum is the name of the gold, where this gold is incorporated in this compound. That's why auranofin, orothioglucose, orothioglutaminate, orothiomallate, sodium. Miscellaneous category, nabubutin, nimesulide, that is also banned, analgin, but these are the drugs sometimes used in India also. And drug used in gout, that is the allopurinol, probenecid, and sulfapirazole. Important drug for the gout, that is the uric acid deposition in our knee, in the shoulder, and in the bones, like this. So coming to the first category, sodium salicylate, that is the aspirin acid derivative. I'm discussing the aspirin, that is very known drug. You have studied about this. So known as the acetyl salicylic because OCH3 group has been incorporated for the salicylic acid. Used to treat pain, fever, and inflammation. Specific inflammatory condition like the Kawasaki disease and pericarditis and rheumatic fever. Okay. Some common side effects like the heart attack, even shortly after a heart attack, is a risk of death. Uses and some side effects I'm going. After use long term to help prevent further heart attacks, ischemic strokes, blood clots in the people at high risk, may also decrease the risk of certain type of cancer, particularly colorectal cancer. One common adverse effect like the upset of the stomach that may cause the stomach ulcer. More significant side effect use stomach ulcer, stomach bleeding, and worsening of the asthma. So this is acid derivative. This is methanoic acid that is important. Dimethyl phenyl amino benzoic acid used to treat moderate pain and menstrual pain. It has been formulated and it can be available in the market also. They have common mild side effects like the headaches, nervousness, vomiting. Serious side effects may include diarrhea, hematosis, vomiting blood, hematuria, skin rash, blood vision, itching, swelling, like this. Not so much. It has been associated with the liver damage also. The synthesis you have to study where 2-chlorobenzoic acid is reacted with 2,3-dimethyl benzamine and copper bronze aluminum condensation makes the mefenamic acid where the amino group is condensing the. Another drug meclofenamide not required for you. Indomethacin you study analgesic, anti-inflammatory, antibiotic. You may listen about this drug in your exam also. Potent drug with many serious side effects should not be considered as analgesic for minor aches or minor fever. So it is a very critical drug, should be used for major cases like surgery, cancerous pain. Okay. Anti-inflammatory rather than an analgesic. It is basically anti-inflammatory. Sulindrec, one of the drug, crystalline powder, very soluble water, soluble in methylene chloride and dilute solution of alkyl hydroxide, sparingly soluble in alcohol also. Sulindrec, you should study about the J isomer of the sulindrec showed much more potent anti-inflammatory activity than the corresponding isomer. The more polar and inactive sulfoxide is virtually the only form of excreted. It has analgesic, antibiotic, and anti-inflammatory properties also. It is also employed in the treatment of rheumatic and musculoskeletal disorder, acute gouty arthritis, and osteoarthritis. Tolmetine, one of the important drugs you should study. Side effects are there. Zompirac, one of the drugs. Diclofenac, most important, dichlorofenamic acid is there. That's why chlorine is attached. Sold under the trade name of Voletran, among other drugs. Used to treat pain and inflammatory disease such as the gout, very important for the rheumatoid arthritis. Next, side effects. There are some side effects like the abnormal pain, gastrointestinal bleeding, nausea, dizziness, headache, swelling, and serious side effect include the heart disease, stroke, kidney problem if they are continuous use, and stomach ulceration also there. That's why painkiller drugs should not be used for a continuous time. Ketorolac, important drug that is used for the pain of the teeth, soluble in water and ethanol and methylene chloride. Potent analgesic treatment for the moderately severe and acute pain. Ibuprofen, most important drug, we should study the structure. Isobutyl propionic acid. Isobutyl group is there, propionic acid is there. That's why isobutyl propionic acid. Treating pain, fever, and inflammation, menstrual pain, migraine, rheumatoid arthritis, and side effects include heartburn and rashes. Acidity may form. Fever side effect, gastrointestinal bleeding. Increase the risk of heart failure, kidney failure, and liver failure if continued use. Ibuprofen synthesis you should study. Isobutyl benzene. Acetylation is going on. So CO6 groups are introduced. Para-isobutyl acetophen. HCN is used where it will cause the CN introduction into the C of the acetyl group and it will increase the number of carbon cyanohydrin derivative and reduction with hydrolysis hydroiodic acid it converts CWH CH3 to CWH. As a result, ibuprofen is formed. You should study in very important way. Naproxen, one of the severe category drug. related with laser frequency and severity of nervous system together with the mild GI effects. Process analgesic, anti-inflammatory, antibiotic action, which is the treatment of rheumatic activity, dysmenorrhea, acute gout, etc. Pyroxicum structure should be studied, treatment of rheumatoid, osteoarthritis, dysmenorrhea, post-operative pain, analgesic, especially where there is inflammatory content there. Side effects are there, like normal side effects, you should study a same amount of phenacetinone, the important one. Sometimes you will find it. Acetamine, paracetamol, that should be studied very with cautious. Used to treat acetaminophenol, paracetaminophenols. It is typically used for mild to moderate pain relief, sold in combination with other medication. Generally, safe at recommended dose maximally daily dose for an adult is 3 to 4 grams, and the higher doses may lead to toxicity failure. That is safer category drug. Penazone, antipyrin, phenylbutazone, another category. Side effects are there. So thank you everyone for this study, and you should study more for the detailed knowledge. Okay? Thank you.